Austin. I'm going to be your student nurse today. Could you tell me your name and date of birth?
Scotland Warner, 10/22/03.
I'm just going to check that. Good, thank you. Could you tell me your name, where you're at, and what the date is today?
Scotland Warner. I'm at Calvin Huntington Hospital, and it is 1/20/24.
Good. Okay, next I'm going to just check your pupils. So if you could just look straight forward at me. Okay, good. Thank you. Next I'm just going to go ahead and I'm going to take your hand and I'm going to give it a little pinch.
Okay.
Good, thank you. Next I'm going to go ahead and take a look at your nails. Give that a pinch too. Could you open your mouth for me? Good, thank you. So if I could have you sit up a little bit for me, I'm going to go ahead and listen to your respirations and your heart sounds. Good. Good. I'm going to have you take a deep breath in and another one. Deep breath out. Good. And another one. Good, thank you. Next thing I'm gonna do is I'm gonna press on your abdomen.
Okay.
I'm gonna press in all 4 quadrants. So if it hurts, you just let me know.
Okay.
Does that feel okay?
Mm-hmm.
Next I'm gonna go ahead and I'm gonna listen to your stomach. Okay, next I'm gonna go ahead and take your radial pulse. Okay, good. I got 64, so I'm gonna check your other wrist. Good, I got 64 again, so everything is looking normal. Next I'm gonna take a look at your pedal pulse, so I'm gonna have to uncover your feet for you. Okay, I'm gonna go ahead and find your pedal pulse. Oh. Sorry. Okay, I got 62, so I'm gonna go ahead and check it and the other one. Okay, good. I got 62 there too, so that's all good. Okay, so I'm gonna go ahead and check you for some edema.
Okay.
It's looking like we have just a little bit around your ankles. That's okay. I'm gonna check you for any IVs, wounds and dressing, any that you know about.
No.
Okay. Good. Okay, good. Okay, Scotland, could you tell me about the last time you voided?
It was about an hour ago. It kind of burned. It was like a dark yellow, and it wasn't really a lot.
Okay. Did it have any odor?
Yeah, it kind of smelled.
Okay. What about your last stool?
It was about a day ago. It was brown, formed, hard.
Okay. Thank you. Okay, Scotland, I'm just gonna ask you some more questions. Could you tell me how old you are?
20.
What gender?
Female.
And what race would you say?
White.
Okay. And where is your primary location of residence?
Huntington, West Virginia.
Okay. What's your marital status?
Single.
Do you have a religious affiliation?
Catholic.
What's your education level?
I'm currently in college.
Okay. And what occupation would you say?
I'm a student athlete.
Okay. Do you have any significant other, support person?
Yeah, my dad, Scott Warner.
Okay. What language would you say that you speak?
English.
Okay. And then what has brought you in today?
Since about 2 days ago on 117, like I started peeing and it just burned really bad and it's just gotten worse and it's really dark.
Okay. And your prior experiences with healthcare, have you had any fears, any bad past experiences?
No.
Okay. And do you know who your current healthcare provider is?
Joseph Blanchard.
Okay. So you said that it's burning when you pee.
Yes.
Does it have an odor?
Yes, it smells.
Okay. And what color would you say this is?
Very dark yellow.
Okay. And you said this started on 117?
117.
Okay. Has it gotten worse?
It's gotten very worse.
Okay. And where would this be at?
In my like abdominal, like the urine.
Okay. How long would you say that this lasts or reoccurs?
It burns every time I pee.
Okay. How long is there any discomfort in your abdomen that lasts?
Yes.
Okay. And on a pain scale out of 10, 10 being the worst, 1 being the least amount of pain, what would you say that your pain is?
7 out of 10.
Okay. What makes it better? What makes it worse?
The burning feeling and pain gets worse when moving.
Okay. Have you found any relief to this yet?
No.
Okay. What other symptoms do you have, and can you work or continue any activity?
No, it's been hard because of the constant need to pee.
Okay. I'm going to ask you some past health history questions.
Okay.
Have you had a child?
No.
Okay. Have you had any childhood illnesses?
No.
All right. I'm going to ask you about some immunizations. You just tell me yes or no if you've had them. Measles?
Yes.
Mumps?
Yes.
Okay. Rubella?
Yes.
Chickenpox?
Yes.
Hep A?
Yes.
Pneumococcal?
Yes.
Influenza?
Yes.
TB?
Yes, ma'am.
Tetanus?
Yes.
Hep B?
Yes.
Okay, have you had any adult illnesses?
No.
Surgeries?
No.
Accidents?
No.
Prolonged pain or pain patterns?
No.
Allergies?
No.
Okay. Okay, Scotland. Could you sit up for me?
Yeah.
Okay, so I'm gonna go ahead and look at your hair. But before I do that, do you have any rashes, lesions, any excessive sweating,
No.
any hair loss?
No.
Okay. Okay. You just have a small amount of dandruff, but other than that, it's looking pretty good. So I am gonna go ahead and take a look at your head and neck. But before I do that, do you have any stiffness in your head or neck? Okay. Do you have any difficulty swallowing?
No.
Do you have any enlarged lymph nodes that you're aware of?
No.
Sore throat?
No.
Do you have any reason to be concerned about your thyroid?
No.
Okay, I'm just gonna go ahead and take a feel. Okay, can you turn your head for me? Good. Is that any pain there?
Mm-mm.
Okay. Can you swallow for me? Good. Any pain with that?
No.
Okay. For your eyes, do you have any pain, any infections, vision loss?
Nope.
Redness?
No.
Any blurring, any flashes, double vision?
No.
Okay. This is for your ears. Do you have any pain, ringing, buzzing?
Just a little bit of ringing that started 2 days ago.
Okay. Do you have any drainage or hearing loss?
No.
Okay. In your mouth, throat, and nose, do you have any pain, sores, lesions?
No.
Do you have any voice changes?
Nope.
Sinus infections?
No.
Snore that you know of?
No.
Okay. Sneezing a lot, nosebleeds?
Nope.
Okay. For your lungs, do you have any shortness of breath?
No.
Any difficulty breathing with
Mm-mm.
activity or just at night?
No.
Would you say, how many pillows would you say that you sleep with at night?
1.
Okay. Sorry, back to your teeth. Do you have braces?
Yes, I did.
And when did you get those off?
I got them off my senior year of high school.
Okay. And this is for your breasts. Do you have any pains, lumps,
No.
any discharge or dimpling?
No.
Any changes in breast size recently?
No.
Swollen?
No.
Okay. And how often would you say you do a self breast exam?
Once a week, I'd say.
Okay, that's good. I'm gonna go ahead and give them a feel. Okay. Are you having any chest pain? Any pressure you feel in your chest?
No.
Any palpitations?
No.
I did notice some edema in your ankles, but I think that's just from, maybe the urination problems that we're having. Your last blood pressure that we took when you came in was about 110/68, and since you're active, that's normal for it to be low. Have you ever had an EKG?
No.
Okay. Do you have any leg or feet pain?
No.
Okay. Any changes in color of your feet or your legs?
No.
Okay. Are you having any pain in your abdomen?
Just a little bit.
Okay, and when did that start?
2 days ago.
Okay. Is there any difficulty swallowing?
Nope.
Any nausea, vomiting?
No.
Do you have any gas?
No.
Any hernias?
Mm-mm.
Okay. Okay, Scotland, this is just going to be about some of your nutritional habits. How many meals and snacks would you say you eat a day?
2.
2 meals and 2 snacks?
Yes, sorry.
Okay. And how many times would you say you eat the following meals away from your household? Breakfast,
Breakfast 0.
lunch,
2.
and dinner?
1.
Okay. And what types of food places are you visiting? Fast food?
Yes.
Restaurants?
Yes.
Dinner? Diner? Others?
No.
Okay. And on average, about how many pieces of fruit do you think you have a day?
4 pieces.
Do you have any juice?
No.
Okay. And I'm just going to ask you about the beverages you usually drink, and if you do, the servings. So water.
Yeah, about 30 ounces.
Okay, any juice?
No,
Soda?
no,
Diet soda?
no.
What about any sports drinks?
8 ounces.
Okay. Any iced tea?
No,
Beer or hard liquor?
no,
Any 2% milk?
no,
1%?
no,
Skim milk?
no.
Whole milk?
Yes, 6 ounces, I'd say.
Okay, and what about coffee?
Coffee that's caffeinated, 8 ounces.
Okay. Do you drink any iced tea with sugar?
No,
Wine?
no,
Any other?
no.
All right, and on average, how many servings of vegetables do you think you have a day?
0,
Okay. How many times a week do you think you eat a high fiber cereal?
0,
Okay. How many times a week do you eat red meat, which includes beef, lamb, pork?
1,
Okay. How many times a week do you eat chicken or turkey?
0,
How many times a week do you eat fish?
0.
Okay, Scotland. About how many hours of television do you watch every day?
About an hour.
Do you usually snack while you're watching television?
Yeah.
How many times a week do you eat desserts and sweets?
Once a week.
Do you have any food restrictions due to your religious health or anything like that?
No restrictions.
What's your usual weight?
110 pounds.
Have you gained or lost any weight recently?
No.
Have you have any changes in appetite, smell, or chewing?
No.
Do you have any nausea, vomiting, diarrhea, constipation?
A little bit of constipation that started around the same time the UTI.
Okay. Do you have any food allergies or intolerances?
No.
Do you take vitamins?
No.
Do you have enough income to make necessary
Yes.
food purchases? Do you have transportation?
Yes.
Who prepares your meals and does the shopping?
I do.
Could you describe a typical day from the time you wake up to the time you go to bed?
I get up, I go to class, I come do homework, and then I usually just go to practice.
Okay. What are your exercise habits like?
I have cheer practice for 3 times a week, about 2 hours.
Okay. Could you describe your sleep and rest patterns for me?
I usually get 7 hours of sleep each night.
Okay, good. Are you on any prescribed medications?
No,
Do you use tobacco,
no,
alcohol, or
No.
drugs?
oops. No.
Could you describe how you see yourself as a person for me?
I think I'm a good person, surrounded by good support, and I work hard.
Okay. All right. What do you like to do for fun or relaxing?
I like to go shopping with my friends and hang out with them.
How would you say you contribute to society?
I volunteer by doing activities through like cheerleading and like nursing.
Good. Would you say your relationship with your family and other like significant other, anything like that?
I'm close with my parents and my brothers. I have a boyfriend,
Okay.
and I have no pets.
What are your past, current, or future education plans?
I graduated high school in 2022. I'm currently a college student, and I plan to graduate nursing school.
Okay. And do you have a job or anything like that?
No job.
Who pays your bills or manages your budget?
My parents pay my bills.
Okay. What would you say your stressors in life are, and how do you cope with them?
I'd say school and cheer are my stressors, and I like to cope by hanging with my friends and calling my dad.
Could you describe the type of environment or neighborhood that you live in for me?
I live in an apartment with 3 other female roommates, and I feel safe in my apartment.
Do you have a formal religious affiliation, and can you describe that for me?
I'm Catholic, and I believe there is one God, and I go to church every Sunday.
Okay. Could you describe the beliefs and practices of your religion that you accept?
I do Lent around Easter time,
Okay.
and I worship God.
In what ways is your spirituality or religion meaningful for you, and how important is it to you in your daily life?
It's very important, and my religion gives me hope and meaning in my life.
Do you belong to any religious or spiritual groups or communities?
I go to St. Joseph Catholic Church.
Okay. What types of support or help could your group provide for you in dealing with health issues?
My church is very...
What specific practices do you carry out as part of your religious or spiritual life?
I go to church every Sunday as well as saying prayers
Okay.
often.
What lifestyle activities or practices does your religion encourage or discourage? Anything like that?
My religion encouraged Lent, discourages same-sex marriage, and sex before marriage.
Okay, and to what extent do you follow these practices?
I try and follow them as best as I can.
Are there any specific elements of medical care that your religion discourages?
No.
To what extent have you followed these guidelines? Never mind. What aspect of your religion or spirituality should I keep in mind as I care for you?
As long as I have time to pray, that is my only request.
Okay, just a few more questions for
Okay.
you. Are there religious or spiritual practices that you would like to have available to you?
No.
Okay. When you're afraid or in pain, how do you find comfort?
I like to talk to God.
Are there particular aspects of medical care that you wish to forgo or have withheld because of your religion?
No.
Do you have a living will or any specific religious or spiritual practices that relate to time of death or following death?
No.
Okay, thank